as a kid, you know, you do want to be involved in things, but I was usually the kid that was never picked to play in a team or at some kind of group event. I was always one of those last kids standing. You know, you felt that no one really wanted to play with you. And that's so I just kept my distance most of the time.
Kiana Smith was born with Portwine stain and cobblestone malformation, two very uncommon vascular abnormalities that aren't life-threatening, but socially debilitating.
It's taken a lot of years to get where I am at this point. To be able to speak in an interview like this is a really big deal for me. I'm still not very outgoing. I won't go out there and make friends. I'm still pretty much reserved, if you will. I don't want to be that person who sits and watches the world go by. I mean, there's so much out there.
There are so many others with various forms of vascular malformations that have similar stories, because in the past, these lesions were almost always misdiagnosed and inadequately treated, if at all.
There are very few articles published on this. There's very little in the way of literature. The average physician does not come across these patients, and so the tendency to misdiagnose and mistreat is common. Kiana has abnormal blood vessels in a certain area of her body. In her particular instance, it's on her face. Now, these abnormal blood vessels are dilated, and because they're dilated, much more blood flows through them. The increase in blood flow imparts a purplish, reddish color to the skin. But a small percentage of these, probably around 30 or 40% of these patients, experience tissue overgrowth. So what happens is all the layers of the tissue in the area involved just continue to grow after the patient has stopped growing.
Portwine stains are not life-threatening, but as it grows and hypertrophies, it affects her quality of life. So for example, in Kiana's case, she has a very large lower lip. She has difficulties with feeding, with speaking. She may drool at times. It affects her quality of life.
For the past 20 years, Dr. Weiner has worked to develop surgical solutions for this patient population. These procedures are the first of their kind and are greatly improving the quality of life for so many.
Many people regard this as cosmetic surgery. This is not cosmetic surgery. Cosmetic surgery is defined as correcting that which is normal or which appears as a result of the normal process of aging. This is abnormal, and so this is corrective, not cosmetic surgery.
Today, Kiana will undergo her first of a series of operations that will ultimately give her similar results to that of Dr. Weiner's other patients.
It's really a matter of soft tissue contouring. We're not curing her disease, but we're going to certainly improve the symmetry of her face, the contour of her face, and also improve the quality of life.
I don't know if there are words that I can say. I mean, it's really emotional for me. To have this done, I mean, it's incredible. Absolutely incredible.
So that part is okay.
Today, Kiana will undergo her second procedure, but the results from her first surgery are impressive.
As soon as it came out, I realized that, well, number one, I was able to talk, and for the first time in a long time, I had more vision on my left side. Because before, I couldn't see my hand moving around below me. I can see it now. So that was a big, big difference to me. And I can definitely see that I have definition. Basically have a proper looking cheek right now. So I'm pretty happy, pretty happy.
Kiana still has several procedures to go, but because she lives in Trinidad and Tobago, it is logistically and financially difficult for her to do so. She must fly and stay in Manhattan for each surgery, a cost that would stretch many wallets thin. In an effort to spread awareness and help pay for these procedures, Kiana writes a blog and has established a GoFundMe campaign. She is incredibly grateful for the support of those who have contributed and for the work being done by her surgeons.
You know, I'm absolutely excited. I can't wait to come back again. But funding, yeah, that's the one thing that's gonna stop having the next surgery?
I would estimate 1 or 2 more surgical procedures will get her into good shape, and from then on she can have some laser treatment and she'll do very well. The importance of publicity is obviously paramount. It's the only way we're going to get the message out. We publish, we can get it to small sectors of the population through medical publication, but through publicity we can get it to a wider audience, and that's very, very important because there are so many patients who really don't know that there is something that can be done about this.
To learn more or schedule a consultation with Dr. Weiner, visit vbiny.org.